everyone. Thanks for tuning in on Facebook today. Today we're talking about a topic that maybe might be on your minds at the beginning of the summer, not at the end. We're talking about varicose veins. I'm here with Dr. Mather and Dr. Napolitano from Starling Physicians. And this is something that affects a lot of people, men, women.
Yes, commonly about 10% of the population has a problem with vein disease. It may be varicose veins, it may be other problems, restless legs, things like that, swelling, but a fair number of people have it, yes.
And when you think of it, I think a lot of people out there are thinking those bulging veins, they put on their shorts, their bathing suits, but it's not just a cosmetic problem.
Yeah, I think the problem of venous insufficiency is beyond that. Some people can just have swelling, pain, heaviness in their legs without any obvious swollen veins, and they may never realize that this is actually a medically treatable problem induced by the venous insufficiency.
So now, what are some of the symptoms that someone might be suffering from, and maybe they don't know that it's actually vein disease, but they have these different things going on?
Commonly, it's swelling, aching, heaviness, tiredness, fatigue, usually worse as the day goes on. And people with varicose veins experience the same type of symptoms in addition to usually have burning sensation, or the veins get worse, they bulge more as the day goes on. It doesn't have to be associated with standing. Sitting is also bad for veins. So people that have a desk job can also have significant symptoms.
Would you say that sitting for long periods of time, would that increase your risk factor?
Yes, definitely.
And now, this isn't, people see different veins, like they may have varicose, they may have spider veins. Not all of them are really a medical issue. Some of it is just cosmetic, right?
Yeah, once you have these symptoms or visible veins, I think after that, what you really need is a non-invasive evaluation to really assess what the depth of the problem is. If you really have faulty valves where blood may be leaking down to your legs, which is called as venous insufficiency, or not. Now, I would also like to add one more thing we discussed about symptoms. On the extreme end, people can have ulcers and skin changes in the ankle area due to the venous insufficiency.
Now, is this something that could affect someone's ability to be active?
Yes, it can, especially end stage, as Dr. Mather was alluding to with ulcer disease. They spend a lot of time taking care of the wounds, and it definitely impacts their lifestyle. No question about it.
So if you're just joining us on Facebook, we are talking to Dr. Mather and Dr. Napolitano from Starling Physicians. We're talking about vein disease. I think people out there most commonly think of varicose veins and these unsightly veins when you put on your bathing suit or your shorts, but it can be a serious medical issue. Now, what if someone thinks, okay, I have this vein, it maybe hurts a little bit, I'm not sure, what should they do?
The first step is to consult their physician. Usually people go to their primary care physician, and those people are referred to us. The first step, if they come into our office, is to get an ultrasound. Very simple, non-invasive, gives us a lot of information. And from there, we decide if it's appropriate for treatment, what type of treatment, and then we can talk to the patient about that.
And these are things, if it is true vein disease, it's covered by insurance.
Yeah. And 90% of what we do is covered by insurance. The purely cosmetic procedures may or may not be, depending on the patient's insurance. But once with an ultrasound we document real disease, there's very little the insurance companies can do to say that it's not necessary. So,
is there one thing, or maybe a handful of things, if you see these veins on your legs, how do you know that maybe it's something more serious than just, oh, this doesn't look very good?
Well, I think it's hard to say. There is definitely vein disease is much beyond just what we can see from outside. There is an overlap. There could be some serious underlying problems like deep vein thrombosis, cardiac problems, peripheral arterial disease, which is the other aspect of the circulation. And that's why these patients need a comprehensive evaluation to determine exactly what is the problem.
So we talked about some of the common symptoms. If you're just joining us at home, we're talking about vein disease. What are some of the most common symptoms? I know we talked a little bit at the beginning, but I think that's for the people that are just tuning in. Let's go over those again.
Vein disease typically presents with aching, heaviness, tired feeling, fatigue in the legs associated with swelling. Restless legs at times can be also a symptom of vein disease. And then the other side is varicose veins or spider veins that are burning, painful, bulging, and a worsening of that over time. So a lot of people that come in to see me complain, you know, I had a few of these little spider veins a few years ago, now I'm noticing more and more. That can definitely be a sign of worsening reflux disease.
So you shouldn't, you shouldn't think, oh, this is just a cosmetic thing. I don't want to alarm anyone. I'll be okay. But you should.
Not necessarily.
Yeah, you should go see your doctor.
Yes.
And one of the things with vein disease is that the symptoms are so subtle and gradually progressive that a lot of patients accept it as their legs. You know, they don't recognize themselves that they need medical attention. It can be treated. They can feel better because they have developed this over decades. Maybe, after their first or second pregnancy, they started noticing it. And now come their 45, 50 year old, 20 years, they have been living with heaviness and aching in their legs, and they have come to the realization maybe that's just them.
Now, if you catch it earlier, is it easier to treat? I would think.
Not necessarily. Vein disease is not comparable to arterial disease, where if you intervene earlier, it can make a bigger difference. Vein disease is very slowly progressive, and until it gets end stage, you can treat it pretty much the same way at any stage and improve the patient's long-term outcome. So yeah, like anything else, it's better to start early if you can, but as Dr. Mather alluded to, a lot of these patients, the symptoms are pretty mild when it's early, and so they don't seek medical attention, but they don't lose a lot by not getting attention right away.
Now, if someone has the beginning stages of vein disease and they get their veins treated, will it still progress worse later on? Will they come back? Or if you treat a vein, will that prevent it from getting worse in the future?
Vein disease is a genetic problem. People are born with it. And as such, it progresses over time. There are things that we have, such as compression stockings, which will help slow that progression, but it's not going to make it go away. And we can do our procedures and shift where the blood goes, but it doesn't change the disease. What our procedures do is greatly slow the progress of the disease to the point where most people won't end up with ulcers and bad varicose veins over time if it's treated earlier.
So let's talk about some of the treatment options, because I think it's really, the treatment for vein disease has really come a long way in the last decade or two. So, and it doesn't have to be a major surgery. These are minimally invasive things that you guys can do.
Yes.
So tell us a little bit about that.
Well, first of all, a lot of these patients, especially with early disease or mild disease, we like to treat them conservatively with compression stockings and things like that. We have different options of that. Now, let's say a patient continues to have symptoms and especially complications of varicose veins, like some people can have even to the point of bleeding, ulcers, skin changes, and we do move towards more advanced treatment. Then in today's date, we do it as an office-based, catheter-based treatment. It's about a 30-40 minute procedure where we identify the culprit vein with an ultrasound. We insert a small catheter, which is essentially like getting an IV, and we treat it in 30 to 40 minutes, and the patients can go home and return to activities the same day.
Oh. That's pretty great.
Yeah.
Now, what's it like after the procedure? Are there any precautions that the patient needs to take?
We usually have them in ACE bandages for 48 hours. But the only thing we tell them to try and avoid doing is sitting or standing for prolonged periods of time. So we don't want a patient going out for a 3-hour car ride after we've just done the procedure. In fact, we encourage them to walk as much as possible. But most patients don't use pain medication. Wow. Most patients are as active as they want to be right after the procedure, and they come back telling us they can't believe it was that easy.
Wow.
And the studies with these newer treatment modalities have really demonstrated the safety and efficacy of these products. Of course, there are precautions that we have to take. There are things that we look out for. Patients do come back for a checkup ultrasound after 3 to 5 days to make sure that the vein that we treated has closed and there are no inadvertent clots in other veins. So, there are things that we still look out for. But overall, it's a pretty safe procedure with, I would say, in the studies that the catheters have been in, more than 95% success rate.
Wow.
And
That's impressive.
that compares to surgery in the past, which was really the only way we had to treat bad veins in the past. And a similar type of procedure called stripping for the same vein that we now treat endovascularly had about a 25-30% failure rate.
Oh, wow.
And complication rate. And this is the failure rate for what we do is less than 5%. It's a huge difference, not only in patient comfort and care, but in terms of outcomes.
Yeah.
So
Now, and how quickly are the results seen? Right away?
if you ultrasound
Wow.
the vein after we do the treatment, it's most of the time it's closed. Sometimes it takes, a matter of days to close, but it's almost immediate.
Wow. So don't wait. That's the go get it done. Go if you have these veins and you have a vein that bothers you, maybe it looks unsightly, it's aching, burning, you should really go see your doctor.
Yeah, I think as Dr. Mather said earlier, it's something that should be looked into. Not necessarily something that has to be treated, but
Right.
it should be looked into. Yeah.
So if you're just joining us, we're talking with Dr. Mather and Dr. Napolitano from Starling Physicians. We're talking about vein disease. I said in the beginning, I know it's something that a lot of people think about when summer starts, when they start putting on their shorts. They're like, oh, maybe I should have gotten this looked at. Now, when is the best time to really start this process? If you want your legs summer ready for next summer. I mean, medical necessity aside, because I think, that is obviously the most important thing. You want, you don't want to be in pain. You don't want complications down the road. But I think, it really does hit a lot of women, myself included, that you also want to look good. If you feel good and you look good, they kind of go hand in hand. So when should this process get started?
Well, that's a difficult question. I think people have to understand that this disease process has evolved over decades in a lot of these patients, and people have to come in with realistic expectations. If anybody's telling you we're going to get you ready in 3 months, I'm not sure. This is a medical treatment. We do it step by step. It can take time for, as Bob said, people can feel better in 24 to 48 hours. But we have seen people improve and feel better up to 3 to 6 months. It takes time for all that fluid that has accumulated over decades to start mobilizing again after we treat the culprit vein. So it takes time for people to start feeling better, as well as those veins to start shrink. I don't necessarily relate it to let's get them ready for the summer. I think you basically have to get evaluated when you recognize that there is a problem, and just treat it with the guidelines and what we think in our best judgment is the right time to treat it.
In your short answer to your question is you should expect about 6 months from the time we evaluate the patient and initiate treatment, and even if it's injection for varicose veins or spider veins. The full effect of the ablation procedure can take up to 6 months to see the results. And so if patients want to do something for the spring or summer, then usually in the fall.
Now's the time.
Yeah, now's the best time.
So you shouldn't wait. Now, why is it so important? I think, you see a lot of these clinics out there and you don't know if it's a doctor out there, you don't know if, who's supervising. Why is it so important to see an actual medical doctor at a practice?
Well, I think, vein disease can be very complex, and a comprehensive evaluation and treatment is required. What sometimes may be perceived just as a simple reticular vein or a varicose vein may have some serious underlying vascular issues, for example, deep vein thrombosis, or a cardiac problem, or there is an overlap of peripheral arterial disease. And that's why, for a comprehensive evaluation, these need to be evaluated by, somebody who does this every day and has an understanding of, broad understanding of vascular disease.
So if you just tuned in to our Facebook Live today, we're talking to Dr. Mather and Dr. Napolitano from Starling Physicians about vein disease and how to treat it, and there are some great non-invasive options. We talked about the symptoms and when you should see your doctor. You could certainly play this back if you're just tuning in at the end. Where can people find you guys?
My office is in Southington and New Britain, and Dr. Mather is in Glastonbury, Wethersfield, right?
Yeah, and our office address is on the Starling Physicians website. There's also a description of what we do on the webpage.
And we'll post all of that in the comments below this video if you're watching it now, if you're watching it later. So we'll make sure if people need to get a hold of you, they can get a hold of you. Don't wait. That's the message here. Don't suffer through the pain. You never know. It can't hurt to go see a doctor and get evaluated.
And check out our website because we are going to be doing free screenings.
Oh, free screenings. So we'll post all the information for that. So if you're not sure, why not take advantage of something like that?
Yes.
Thank you, doctors, for joining me today.
Thank you.
Have a good day, everybody.